this hospital in Kathmandu, Dr. Subhas Acharya faces a challenge. There isn't enough medication for his patients in the intensive care unit.
Since last couple of weeks, we have been facing problems with medications that are used to support the hemodynamic of the patients. That means commonly used as resuscitative drugs that we use in CPR.
Families of patients have to find drugs from local pharmacies, but many have been unable to do so. According to UNICEF, all health facilities in Nepal have less than half the required amount of drugs, including childhood vaccines. The situation, which is also affecting other essentials, has been developing for almost 3 months now. That's because protesters from Nepal's southern plains have been occupying areas near border crossings between Nepal and India. Violence in the region has killed at least 50 people. Protesters say they want better representation in the country's newly implemented constitution. And this has restricted imports into the landlocked country. India says its truck drivers don't feel safe driving into Nepal. Now UNICEF says the shortage could have severe impact on the health of children here.
There are altogether estimated 3 million children under 5 years of age, and they are all considered to be vulnerable to the current situation.
But government officials say all the necessary drugs have been sent to hospitals.
The hospital are quite comfortable. Yesterday also, I spoke with the coordinator of the Valley Group of the hospital at this crisis. So Dr. Dilip Mara, he maintained that we are quite comfortable at the moment.
Officials told us hospitals have all the required stock for over a month.
We've been given these medical prescriptions for critical care patients, and we're going to try and find out whether or not they're actually available.
We had to go to 15 pharmacies to find the first 5 medications we needed. But we could not find 2 vital drugs for increasing blood pressure anywhere in Kathmandu.
Life-saving injectables are not produced in Nepal. They have to be airlifted. I have been informed that government hospital suppliers are putting a profit margin and supplying medicines to private hospitals, thus creating a crisis. We have asked hospitals to submit the list of those suppliers.
Suppliers say they're doing their best to distribute drugs despite limited fuel. In the meantime, volunteers are helping patients find drugs.
So this is a platform to help crowdsource the availability of drugs. We find it, we update it with Phil so people don't spend more time looking for it.
Back at Dr. Subhash's hospital, some still have to rely on themselves to find the drugs they need. The government has set up a telephone line to help patients find the medications they need. But doctors say that if it does not address the political crisis at its border, then the health of the nation will be at stake. Subina Shrestha, Al Jazeera.